Hello, everybody. This is Keith Caldwell. We're getting started. We're going to talk about today the Medicaid and how that program is currently funded, what kind of proposed changes to Medicaid are going to happen, and what it's going to look like in particular for our children. So I've asked a chartered special need planning consultant, did I get that right, Ryan? Or something like that, to come join us today to sort of talk about how Medicaid and how it's currently funded and how it looks for the proposed changes that are in front of the U.S. Senate today. So, Ryan, why don't you go ahead and introduce yourself and tell us all about it?
You got it. Well, my name's Ryan Platt, and I founded a company called A Special Needs Plan back in 2005. So I've had the honor of serving families that have children with a diagnosis or with a disability to help them put together a plan for their child's future. And for most, if not all, the families we serve, government benefits are a big part of that planning. And some of those government benefits, Keith, are Medicaid, which is where we're going to focus today. Other pieces of that planning is SSI, which is Supplemental Security Income, which is a monthly income. But, you know, the reason that Keith, you and I wanted to grab some time for people today is of all the kind of chatter, there's a lot of it, obviously, and everybody that's online has an interest here. So I'm assuming they have a loved one, either a child or a family member that is either receiving some type of service from Medicaid today or will be in the future. So it's kind of part of their plan. And they've heard different things over the last, probably since about March, about, you know, the proposed change to healthcare and the new healthcare bill. You know, I had the honor, Keith, in March of this year with the ARC of North Carolina to attend the 2017 Disability Policy Summit. And it was an amazing experience up in Washington, D.C., learn about how the budgeting process works, the appropriation of different federal funds to different federal programs. That was the week that the House was going to vote on their healthcare bill that they were proposing. So it was very apropos. We were there. And so, you know, one of the things that we just wanted to do today was just at a high level for everybody. In the event you haven't had a chance to really dive into what the impact of some of these changes may be for Medicaid and then how that trickles down to your family possibly. And we're going to start with just kind of give you an overview of how Medicaid funding really works, right? How do these services actually get to you? And how do the dollars behind them function? Because that's what the proposed changes are going to impact. It's going to impact the dollar flow, which then obviously the dollar flow and the funding flow will eventually impact the possible services rendered for your child. So, you know, right now, currently, Medicaid is a guaranteed program, guaranteed coverage for adult Medicaid. This is not any waiver programs that you may have in each individual state, but Medicaid itself is a guaranteed coverage. There's no waiting list. There's no caps to it. It's federal funding is guaranteed to each state. Each state receives funding from the federal government to help pay for Medicaid. So a very interesting fact is Medicaid for most states is one of their largest expenses, but it's also one of their largest revenue streams from the federal government. Yeah. Most states, in terms of federal funds that flow into states, 50 around, and this, please don't quote this number, it's different, a little bit different for each state, but on average, it's about 56 to 58% of all federal funds that come into each individual state are for Medicaid purposes. And so it's a big revenue generator for states. As well as obviously an expense. But right now, those federal funds are guaranteed. States are guaranteed to receive at least $1 in federal funds for every dollar that the state spends on the program. And there's no preset limit right now. There's no preset limit. Now, each state also has their own matching rate. Depends on each state's revenue and what the economics of each state looks like. So that does change a little bit. But on average, the federal government pays about 60% of all Medicaid costs, and the state pays about 40%. Mm-hmm. In terms of how it functions right now. And again, the biggest thing there is there's no preset limit. There's no cap on that. If somebody needs Medicaid and they qualify is obviously the item, right? They get it, right? The federal funds are there. State funds are there. It's going to get matched regardless of how many people you have, regardless of who's getting approved and who's not. And those dollars are going to be there. So it's required by law that those dollars are there, regardless of how many people need it and how many people are approved for it. And that's important, one, because, 15% of all folks on Medicaid have a disability or are diagnosed with a disability. Mm-hmm. But yet 42% of Medicaid funds go to that 15%. So although only 15% of folks on Medicaid are diagnosed with a disability, 42% of Medicaid's money goes to that 15%. So it's a really big portion of the planning that we do with families and that families are counting on for their child's future to help with some of those long-term support services like housing and transportation and supportive employment and just things that, healthcare, obviously, the medical side, the prescription. So all the things that we want our child to be able to live in the community, Medicaid helps to support those dollars. Mm-hmm. And so that's why it's such a big portion of the planning for an individual that is diagnosed with a disability, especially an intellectual and developmental disability. So that's why Medicaid's important. A lot of you, already know that. And so what's happening now, which you've probably heard, is with the new healthcare proposals that were in the House and now that have gone to the Senate. Again, nothing is concrete, right? Nothing's been passed. So I don't want you to think, oh my gosh, this is final, this is done, this has been passed. It's not, okay? These are just proposals. And so we just want to give you an idea of what the changes may look like. Right now, the new healthcare reforms, on average, it appears as though over the next 10 years, it would end up being about an $880 billion cut to Medicaid funding. That's an $880 billion cut to Medicaid funding.
$880 billion.
Right, over the next 10 years. And some of the reasons for that is how they may change the financing of Medicaid and how that funding works. There are two different ways that they may do that. Excuse me. One is called a block grant, which means that basically, again, high level discussion is basically it's not guaranteed any longer. So it's really not even going to be, it's not really going to be considered an entitlement program any longer. What it would mean is that each state, the federal government would say, okay, here's how much money we are going to give you each year. Here's the dollar amount, right? It's kind of like if you go to your employer and you're employed and they say, here's your salary for the year, right? Now you have to determine at a household level how you're going to spend that, right? So if you end up beginning the year with one child and all of a sudden you have triplets in September, right? Well, now you have more people to care for during the year on the same dollar figure, right? Because your salary didn't change. That's kind of how block grants work, right? Here's your dollar amount. You guys are going to have to determine how to allocate it out, whether you have more people applying for Medicaid services and more people for that need. The dollar amount from the federal government will not go up. Whereas today that goes up, right? It's just part of it. Whoever gets approved, and whenever they get approved, federal government will start to help fund it, right? So it'll always rise. Block grants doesn't rise anymore. So so the federal funding is then capped, right? So it's one, for a federal government side, it's easier for them to plan, right? They know on a budgetary purpose what that number is going to be. So it's not based on enrollment, right? Not based on program need. It also will have a fixed preset growth rate, right? Which means that they put a inflation number to the amount that they allocate to each state. So for example, they may say, okay, just again with your salary, right? Okay, here, let's give an example. Okay, you're going to earn $100,000 this year, and it's going to rise by 3% each year. So next year, you're going to get $103,000. You know what? It doesn't matter if gas prices go to $10 a gallon. They're going to give you 3%. You're going to earn $103,000. You're going to have to figure out how it works. Buy a different car. I don't know. Sell your car. Ride your bike. They're not increasing it based upon what the actual expense increase looks like. And that's one of the issues with the House bill. We'll see how the Senate one ends up coming out, is that growth rate that they have assigned to kind of this fixed number to each state is lower than the expected rise in these types of long-term support and services and healthcare costs. That's where a lot of the shortfall starts to come in 5, 6, 7, 8 years down the line, because their growth rate, the proposed growth rate goes like this, the actual one is expected up here. So that shortfall becomes larger later.
Let me ask you a question, Ryan. I've heard it described like this, and this made a lot of sense to me, and it might make sense to other parents out there. So if you have, as an example, if you have $1,000 that is currently what it costs to provide the need right now, what the new proposal is that we're going to give you $1,030 next year, irrespective of the increased growth. So if you have a lot more people who have need or more severe needs, they're not going to cover that. They're going to just say, so over time, you're going to have less dollars per person, right, who are currently qualified, and less dollars per person overall based upon how it is currently. Meaning currently, if there's increased need, they get increased money. Now they're saying basically, irrespective of the increased need, here is your set pot. So I think that's going to make states have to make tough decisions in the future. So I'm, as a parent of a kid with a disability, I'm concerned with, well, what happens in 30 or 40 years? If this is happening in 10 years and my son has $10,000 worth of need now and his true need in the future is $50,000 a year, but they're only going to give him 15, who makes up the shortfall? Especially if I'm no longer here. So that's one of the things that concerns me about the structural change here as it looks to me. I got a quick question from Russ. I'm not sure where you're from, Russ, but let me go ahead and ask that question so you can do it. And maybe it's at a different time in the webinar. But Russ asked, why do some states embrace Medicaid and others hold it at arm's length? Can you talk on that a little bit?
Yeah, and I'm not sure exactly what Russ is referring to. I'm going to take in a leap that maybe it was the each state, when the Affordable Care Act was passed, had the ability to approve Medicaid expansion, meaning it increased the federal poverty level number that allowed people to qualify for Medicaid. Some states took advantage of that. Some states did not. The reasoning behind states not doing it from most of those folks who voted against it in their state was that was a phase out system of federal funding, which it is from the Affordable Care Act. If the Affordable Care Act stays the way it is, then that federal funding to help pay for that expansion will be gone in either 2019 or 2020, right? So a lot of states were like, well, shoot, if that's going to be gone, yeah, you're going to help me pay for it now. But all of a sudden, 19 and 20, I'm going to have to cover that expansion myself. So that was the rationale behind some states deciding not to do it.
Mm-hmm.
With the new healthcare proposal, that might not make any difference at this point anyway, because that expansion is probably going to be not as expansive.
That's one way to say it.
Lack of a better term. Going back to block grants, there's also another way that they're thinking about doing it, which is probably more of I know a number of congressmen kind of like this way better if they do move forward. It's called per capita, right? So it's kind of capped per enrollee. So they cap it per person. So it's not an overall budget number that says this is all you're getting for the year, like a block grant, right? Hey, this is the number you're getting, that's it. This would be a capped number per enrollee. So if you add enrollees during the year, enrollee is just somebody got approved for Medicaid, right? Mm-hmm. So if you added someone who got approved for Medicaid, there'd still be dollars for them, but they would kind of basically get their own budget, right? So they would get their own budget. So again, if the block grant was $1,000, right? And you had a bunch of people come on, you have to fit them in within the $1,000. But maybe each person that comes in gets 100. So if you have more than 10 people, that's okay. If you have 20 people, you're going to get $2,000, right? Everybody's going to get 100. That's a simple way to think of that, right? So the per capita is where more of at least the ones that I've talked to, that's kind of the direction that they'd like to see because they feel it's more flexible, right? And it gives the states a little bit more guaranteed money, right? Because now at least each enrollee is guaranteed their certain budget, right? But it's going to be capped per enrollee.
But let me ask you a question. How do they evaluate different needs? I mean, my son may need X right now, but need X plus Y in the future. And another person here currently might have needs that are significantly higher than my son's. And will only get higher. How do they decide? Is it based upon current need as their baseline, or is it just like everybody gets the same dollar amount no matter of need?
Yeah, and that's still a little bit unknown. Right now, on the federal level, it's not initially based on the healthcare cost or need of that individual. They take that into consideration, but it may not cover everything they need because it's going to be basically a fixed number per enrollee, right? So it's kind of a fixed dollar amount per enrollee, not necessarily extremely specific. Does that make sense?
Yeah.
So there's still going to be caps to it, right? There's still going to be caps. It's just going to be capped per enrollee versus capped as an overall global program like a block grant would do.
Well, I'm not the sharpest tool in the box, but that makes absolutely no sense to me that everybody would get the same dollar amount and the same growth rate.
Yeah, and I'm not sure again, they're most likely everybody's not going to get the same dollar amount. Okay. It probably will be based on some sort of
consideration towards need.
Yeah, you fit within a certain parameter. Mm-hmm. It won't be specifically you, but it'll be, okay, you kind of fit over here, so you're going to be capped at this number versus somebody else might fit in this box over here and be capped over here. I'm not sure yet exactly what that would look like. But what it does is it still gives the federal government the ability to kind of know their costs a little bit better and then also reduce those costs over time. Because, again, the same issue with the growth rate of that budget, so to speak, or that dollar amount, unfortunately, is still, looking at the different bills, is still going to be a lower inflationary number than the actual costs of those services will rise at. At least that's what the expectation is. So there's still, like you said, Keith, over time, that chart is going to show a dramatic difference between what that person really needs and what that dollar amount will provide, because it's just going to get larger based upon unless they change the inflation number, which that's one thing that I hope they do. That would at least make it better, right? That would make that shortfall less. because that inflationary number would stay a little bit closer to the true number. But again, one of the reasons that they add that in there is, again, to try on a budgetary side, to not pay as much over that time. Kind of what that means. So that's kind of what the possible changes look like. It's regardless of which way they go, if it all gets passed, Medicaid will be capped from a federal level, right? It's gonna be capped in terms of federal money. Remember, that's the biggest difference, right? Today, no cap, guaranteed enrollment, guaranteed coverage, no cap whatsoever from federal funding to the state. Going forward, federal funding is capped, right? So what does that mean, really? Well, what that means is the state will have to make up the difference if they want to, right? So the states have to make up the difference. And so my concern is, I don't know if anybody watched the news, but the state of Illinois was just going through their budgetary process, and they were threatening a government shutdown and all those kind of things at a state level. And they finally passed something. But I believe when I was listening to it, Illinois has a pension for policemen, firefighters, teachers, everything else. That's $13 billion in the red. They have problems passing a budget at a state level. And a lot of states do. And so the issue that I see is, how much pressure can the states really take in terms of dollar amounts to help make up that difference from the federal government? And that's probably where we're going to see some of the differences. And I'll give you some examples. Again, depending on the age of your child, a lot of people don't think about school systems and public school systems and special education and Medicaid, when in reality, Medicaid does help support some special education services. So again, a lot of school systems can bill Medicaid for some therapies, right? So they can bill for speech, PT, mental health therapies, even equipment like hearing aids or parts of special school buses, wheelchairs, things like that. And again, if Medicaid gets cut in a certain way, those schools aren't going to initially get that. So now local municipalities and states will have to decide, are we going to allocate more money to special education for those things, or are we going to cut some of the services?
Let me ask you a question. This hits me hard. So if I'm hearing you correctly, you're saying that if the proposals as they're currently considered actually go through, then the future for our children are going to be decided by people who are going to be making budgetary considerations that affect our kids, and our kids may not necessarily be part of it, and or not the most able to advocate for themselves. I mean, it seems like I can see what's not happening is that they're not going after Social Security, because people who are more senior tend to vote and will vote people out. The Medicaid seems like the easiest one to attack because it's the poor and the disabled. So I'm really concerned about how that plays out in the future, especially, we as parents know we're not going to be here forever. So if things are getting driven down and driven down and driven down, who's going to fight for our kids then?
It's a good question, Keith.
It's a really good question. And it just hit me that's really what we're talking about.
Right. I think, as always, it's going to be parents and family that fight, as it has been for.
I get tired of fighting, but I'm talking about when we're not here. 50 years down the line, God willing, I'm not here, and we have this delta between what my kid really needs and what my kid actually gets, and it's increasing. Who's going to speak for him? Right? My other kids have their own lives. I'm sorry, I'm going off on a tangent, but it just hit me when you said that. I'm going to grab Tony and Patricia's questions.
And I think that your sentiment very much resembles Tony's sentiment about the fact of if something passes similar, what options do families have who have planned their finances based on having Medicaid services as a given for their adult child with disabilities? And if that's Tony, who I think it might be, it's a great question, and probably, and again, this is going to sound selfish from me, but this is one of the risks that I've talked about for 10 years with families, and that I talk about in every seminar that I give, and it's called government benefit risk, and now it's happening, and I don't believe it's going to stop happening. I think as hard as it is, we need to figure out how on a individual household level to plan for possible future less financial help from the government. And that puts a lot more burden on families. That puts a lot more burden on the individuals. So, and again, what does that do? I mean, that changes a lot of how families decide to live their life. I mean, it's very interesting. I have several families that come in and they're like, and they're already, 55 or 60. And as we talk about this, they're like, well, I was planning on retiring at 65, but I guess I have to work till 75 now. And unfortunately, if I'm still alive, and unfortunately, that's it. I don't mean to be the bearer of, but that's probably going to be closer to what would have to happen. And you're going to have to buy more life insurance than you think you need to just balance that out. Because we don't know
life insurance, Ryan.
Yeah. And if you can't, you're right. Then we have to look at a lot of different options in terms of what and how to do. And again, in some situations, we're already beyond that point. And it's going to be. I was sitting with a family the other day, and I was sitting with the mom, dad, and one of the siblings and her husband. And it's something that parents don't want to do. As you said, Keith, my other son's going to be doing something else, living his life. And it may become more important to have more family involvement, kind of like when you're taking care of an aged parent, which is, I know, a challenge and not what people want to hear. But if the government's not going to help, it means we have to figure out a way in the community to help. And I think that's going to happen. I know here in Charlotte, there's a housing project that is very much on the infancy stage, kind of building a community of folks where they can, where folks with varying levels of abilities can live, together, and hopefully be able to do that in a way that some of the benefits that are available will be able to support that. Again, I don't know the complete answer.
Right. Let me take a couple questions. I mean, I hope we have a positive spin in the end, Ryan, because I'm a little, it's something we hadn't thought about. I mean, we sort of counted on some of those benefits being available for our kids. And if they're being assaulted now while we're still physically able to do something about it, what's going to happen in 25 years, 30 years when we're no longer here, or we no longer have the same energy level? So anyhow, that's me pontificating.
It's going to be the parents that are 30 years younger than you.
So you guys get to work. So let me take a couple questions. So I think a couple people said that they were added with Medicaid expansion. Their kids were added to this is Medicaid expansion. They want to know if these proposals being considered are going to kick their kids off of Medicaid.
That's going to be based on your state decision. Okay. At least that's what it looks like at this point.
We don't have a lot of information on that, as everyone knows that the the bill was being considered behind closed doors and
Right.
nobody's really had a chance. But what we do know is that a lot of the large organizations are opposed to it. I mean, from the American Medical Associations to the ARC to on and on and on. AARP is opposed to it for various reasons. So there's some truth to that. Now, Don and Joy asked the question of, we were understanding that the Medicaid cuts were aimed at straight Medicaid rather than disability-based Medicaid. Is there any truth to that?
That's a good question. It's based on the Medicaid funding. So it's really not based on Medicaid for people with disabilities or Medicaid with people without disabilities. Remember, 42% of Medicaid funding goes to people with disabilities. 42%. So let's say, and I know Tony mentioned in her question, Medicaid waiver services, a little bit different from maybe straight Medicaid. But again, Medicaid waiver services also have kind of funding streams from federal, state, local levels, different places. So, if the state has to take some funding for Medicaid folks, if they have to increase their funding for Medicaid folks who are not disabled, then that's going to eventually carry on down the kind of the mountain, because there's going to be less money, whether it's for the waiver services or whether it's for adult Medicaid for individuals with disabilities or individuals without, because the federal funding is going to be cut. So the states are going to have to it's really going to be the states making that decision of how they're going to spend the Medicaid funds from the government, from the federal government, the federal funding, and then how they're going to do with how they're going to handle it with their individual states. So I think a lot of that, Dawn and Joy, are going to come from the individual states and how they're going to figure out how they're going to manage with whatever system the federal government decides to move forward with. Because again, what it's doing, everybody, is remember that, they talk about entitlement programs. Well, entitlement programs are, Social Security, Medicaid, and Medicare, right? You just get them no matter who you are. As long as Medicare and Social Security, you qualified, you're going to get it. Medicaid, you're going to get it. What they're doing is they're basically changing Medicaid from because entitlement programs are just like the other day, they're guaranteed, no wait list, no matter what, you get it as long as you qualify, right? Well, now with these other programs, it's really not going to be an entitlement program because it's not going to be guaranteed in terms of the federal money. It's going to be guaranteed to a level, but it's not guaranteed all the time.
So let me make sure I'm clear, and I think I am, but just to clarify, so it's absolutely clear to those watching as well. So right now, I live in California, and California is doing very, very well financially. No budget deficits, no budget battles right now. But there's been a time in the past when things were not so good.
Right.
And we're talking about multi-billion-dollar discrepancies on income and expense.
Right.
And they had to make some tough decisions. So it sounds like what you're saying is, in dire situations, or if you live in states that don't do as well potentially financially, then the states are going to have to make decisions that could affect funding for our kids, for the programs that support our kids annually. So if there's a shortfall and there's not enough money, the loudest voice is going to be the one heard. So if we don't have a advocacy organization that's advocating on behalf of our children, our kids with disabilities, and in theory, people who have a louder voice are more organized about it could take that money.
Sure. Just part of the budgetary process. You're right.
And right now, it's not part of the budgetary process because it's guaranteed issue. If you qualify, you get the money, and there's set growth rates, and everyone participates in it. So that's mind-boggling to me, Ryan, in that sense. So anyhow, let's take a real quick question.
It's just kind of it's giving more responsibility and decision making to the states.
And if you live in a generous state, you're less risky, because California, we tend to be somewhat generous in these areas. But I know that when we were having those multi-billion-dollar budget deficits, wow, I'm so glad that kids with disabilities were not caught up into those areas, right? I mean, this is the one thing I think that sort of brings everybody together, whether you're a Republican or Democrat, or if you're rich or you're poor, you're black or white. If you've got a kid with a disability, you've got a concern. So I think this is one of those areas that we can take off any partisan things to say, hey, we need to advocate for our kids, period.
Right.
So,
yeah, because like Tony said, that's usually a big part of the plan for families and for individuals with a disability. I mean, living in the community, we need some of these support services. We need those home and community-based supports. We need somebody coming in. We need day programs. We need, these different camps that are out. I mean, we need different things to have a life in the community. And that's really what Medicaid supports, an entire industry of people, right? It supports individuals, but it supports the people who support that individual, right? They're employees of a company that then go out and buy stuff in the community and pay taxes and keep that part of the economic engine moving, right? A lot of times these services allow parents to be able to work, or allow both parents to be able to have a job, and therefore increase the income, increase the tax base, go out and spend money in the local community, right? That's, to me, that's the conversation with lawmakers, is the Medicaid, the economy that Medicaid supports is much bigger than just the families that have a child with a disability or an individual on Medicaid, because that supports companies of people who support them, which provide revenue to those companies, which provide income, which provides unemployment to be lower, which provides more income taxes going to the federal and state government, which provide more state sales tax and county sales tax to support local communities, which allows them to buy a house, which then they pay property taxes to their city and counties to support schools and garbage collection. And then they go buy goods at the local business and the pizza shop on Friday night. And if they didn't have those jobs, then that ripple effect of Medicaid is a much larger economic engine than what they're just looking at in terms of the cost. And if you're going to ask a question, I already asked it and no one had an answer. What is that number? What is that economic ripple effect? Nobody has it, unfortunately, because I asked like a billion times. But that is, to me, that's the argument that resonates with somebody that has to make overall economic and financial decisions for an entire country of 330 million people, right? That, because I try to put myself, and don't get mad at me, everybody, you might never want to talk to me again, but if I put myself in their position, right? And I told the congressman this when I was sitting there with him. I was like, hey, man, everybody's knocking on your door wanting what they want, right? Don't do this to me. Keep my program going. I don't care if it's the farmer, the wind farmer, the solar panel guy, the oil company, the pharmaceutical company, the disability community, the silver foxes with Social Security and Medicare. I don't care. It doesn't matter. They're lined up by these people's offices wanting what they want, right? And that's what they're talking to them about. So not only talk to them about your individual family story, because they also like to hear that. They love to hear an example of your life and what this program does for your life and your family, and how any changes to it or reduction in it would impact your family. They love to hear that. But also give them a little bit of view of, here's the overall economy, right? that you're going to massively change. It is an ecosystem on its own, right? And so because we're going to ask you to do the same thing every other organization's asking you to do, right? We're not going to send you anything because you already got emails from the ARC and Autism Societies and disability rights organizations of each state. You already got the emails, you got the links, they already did the work. We're not doing that. But if you do call, you do email, mention a little bit about that. Mention a little bit about the Medicaid economic engine that employs people, that supports families that don't have a child with a disability because they work in the disability community. And that's how they raise their family and send their child to college and do all those different pieces, right? Widen it out. Make it bigger than just our community, because it is. It is it's an entire societal event. Because as awful as it is, and this is not meant to be a downer, but 44% of the homeless population has a disability or a mental health issue. So the issue is, where does everybody go? It goes back to Tony's thing. We've been planning on this stuff to help us. And now if it's gone, what happens? That's the dark side of what happens. They don't want a bunch of people living on the street. It's not what they want. But they don't understand that that is what could happen. Right? That is what could happen. And they don't want that. I promise you, they don't. So it's, you can go on that piece. I talked a lot about the economic engine when I was talking to him. I think that's an important element for who is in power right now. They want to know, how is economics impacted, right? And hey, they are caring people. They're not like jerky, uncaring folks. They just don't know. No idea. And nobody does unless they have a child with a disability. You guys know that. I was talking to a dad and he's like, man, my child got diagnosed with a disability. I live like in a different world than all my other friends. And some of them don't even know how to talk to me anymore. And so they don't know either. So to me, you have to break it down. What happens to my family? And, there's an economic engine here that you're going to really disrupt. That I believe is probably worth more than $880 billion over 10 years. But I have no numbers for that. So don't say anything. Don't give any numbers because I don't know.
As a related issue, I remember seeing an article or seeing a video on the impact of Medicaid expansion in West Virginia, that a lot of people had insurance who didn't have an insurance, not necessarily because of disabilities, but just Medicaid expansion in general, and that they had more clinics, more doctors, more nurses, and it impacted them because these rural communities could have these businesses that would help support people who got medical insurance as a result of Medicaid expansion. And they were talking about how by getting rid of it, gets rid of that local community of support for it. So it's a ripple effect. So not only do the people lose their health insurance, the people who are supporting those with the health insurance lose their jobs because there's nobody there to serve any longer. So it does have that ripple effect. And I think what we need to do a real good job is sort of talking to our legislators about how this impacts us. So I just agree with what you said. Now, real quick, I want to bring this up. I don't have it. If you guys are not on the ARC, I got an email from those guys today called Emergency Medicaid Matters to Me letter writing campaign. They're asking people to send a letter, and I'll put into the chat the person's email address, basically telling your story, right? And the states that really, really matter for this, because they're the ones who have senators who are on the fence and who we could potentially, who we could potentially sway, is if you're in Nevada, West Virginia, Alaska, Louisiana, Ohio, Arizona, North Dakota, or Kansas, or you know anybody there, it's important that you get the word out and let them know. So you'll get a link to this video that you can share with people on Facebook, on Twitter, or wherever you do, but let's get the word out. And the email address, and I'll put it in here, is to the ARC. They're coordinated in an effort to sort of let people know from the legislative point of view how this affects us. So I will put that into the chat notes so you guys all have it. Now, real quick, Ryan, Russ asked the question is, do you see the qualification criteria for Medicaid disability changing? Is that something you can handle?
Well, I don't actually see it changing right now, Russ. What I do see, and what I am finding already, is it's getting harder and harder for adults to qualify depending on their diagnosis. So we're having a lot of parents who are for the first time going down to Social Security and are trying to apply for Medicaid at age 18, and is becoming increasingly difficult depending on your child's disability and their ability to get that qualification for Medicaid. So I see them being more difficult or more challenging on the front end of receiving those benefits. That's what we're actually seeing in practice right now. And I see that that's going to continue because they need to really vet who they're going to approve for these for adult Medicaid and SSI, because the money's going to be tight. And so if it does get approved the way that it's going to happen, I see that process getting harder and harder, more and more hoops to jump through, if you could imagine that, Russ, in terms of government benefit hoops and paperwork, and probably more oversight and more specific oversight on how you're using the services, how you're using the dollars, how you're using their dollars. I think it's going to be much more intense to be able to qualify, and then to that annual kind of checkup on how the benefits are being used, I think is going to be a little bit more investigative, so to speak.
And invasive, right?
Yeah, maybe. Yeah.
We got a question from Jesse. Jesse wants to know, do you know if there are any proposed changes to services provided, particularly around nursing care for children?
I don't, Jesse. But if we find out, we can certainly post something on that.
Right. So
I don't know a lot of the specifics yet, just because they're not finished with it. We just know that it's proposed to have some serious cuts. And so eventually that rolls down to the services received by families and individuals.
I've heard from 880 billion to more than $1 trillion in cuts.
Yeah.
And that's
right.
That's hard cuts to Medicaid. Right. That's not talking about the incidental cuts that affect the communities that support those efforts, right? It's going to have a huge
right.
So they say it affects 1/6 of the economy. That 880 billion or 1 trillion is not 1/6. That's a portion of that 1/6, because
no, not even near 1/6 of the economy.
So anyhow, Ryan, do anybody have any other questions before we wrap up for today? We try to keep our webinars about this is actually went a little.
We're a little long. Sorry,
but we saw.
I'm sure we bored everybody to tears. But again, the biggest thing I think Keith said is that, as parents, we've advocated for decades and decades, and that's the only thing that's ever changed anything. And so I know that the community will continue to do that. We just wanted to give you a little bit more information on our side in terms of our slant, looking at it from a planning perspective and from a dad's perspective with Keith, so that hopefully, if you haven't yet already, which many of you may have done already, maybe this urges you to send that email or pick up the phone or something.
We need to pick up the phone and send that email and let people know how this affects us. So our job is to get the word out to you guys here. And your job is to do that with people, put in your Facebook groups about the importance of this Medicaid and how it could affect our kids now and in the future. Because as I said, having a kid with or a child or an adult with a disability is something that transcends partisan politics, economic politics, identity politics. It does not matter. We care about our kids and we want to do the best for them and protect them. So anyhow, everybody, thank you guys all for joining us.
And just like Keith mentioned and Tony mentioned about planning for the future, and this is not a commercial for me, but Keith and I have been working on a project. We've been doing these webinars for 3 or 4 years, and it is our goal that you get the information you need regardless of if government benefits are cut. So you know what to do, how to do it to make sure your child's okay. With this email, you also got an invite to that webinar for what's called howtosecurethefuture.com that we're launching specifically for families to try to overcome what happens on a macro level as much as you can.
Okay, hey everybody, we're going to end this presentation. I will stay in the chat room for a few minutes answering any questions that we have. Get the word out, guys. Let people know what we're doing and what we can do to sort of hopefully stop this bill, or at least not make it so draconian. Because I didn't realize until you told me today that really it has huge impact on our kids in the future. So anyhow, Ryan, thank you as usual. And we will start getting back to doing regular webinars again. We had a little hiatus from that, but we get asked for it all the time, so we will be back. And thank you guys for joining us.